Thank you. Thank you very much, Andreas and David. Can I ask our panelists, our 5 panelists, to come to the front and take a seat? So panelist number 1, of course, is David, who hopefully hears us. Then Sandeep and Timo Storck and Andreas Weber. And of course, our 4th panelist is the pot of flowers that we have here. And hopefully we'll get the one or the other answer from it. Yeah? So we have a little bit less than 30 minutes, and we'll improvise a little bit. And what's strange about this panel is the moderator will leave the panel in between because he's moderating another panel. So we'll leave it to live, to what's going to happen afterwards. Okay. Yes. Now. Yeah. So this is what you can do with the topic of psychedelics. You can build therapies. You can form theories about it. You can also do natural philosophy with them. So I'll start before we try to connect both. With a very, a little bit crude question, simple question, that is very related to what David also said. Why are psychedelic professionals not shamans? I'll take it from there. You can also, of course, you can contradict myself, you can contradict me, but why are psychedelic professionals not shamans?
Can I start?
Yes.
Well, what is a shaman? A shaman, typically understood, is an individual who engages with unseen forces to provide a variety of services, including healing, divination, sorcery, witchcraft. I think some individuals who use psychedelics do consider themselves shamans, bill themselves as shamans, but in the context of typical clinical usage, it's not, particularly with medicalized psilocybin, where the notion of dysfunction or illness is construed as an individual psychological problem. It's much more appropriate to use a psychological or medical frame for it. Not to say that there are not many people who do use alternate frames.
Timo, so Andreas, in his wonderful talk, gave a natural philosophy that he related to the psychedelic experience, even saying that we are all in kind of a psychedelic experience all the time. I never thought this is some kind of shamanism, no? But is there a space for life philosophy, for a practice of philosophy in the practice of psychotherapy?
Well, first of all, I want to thank both presenters for their rich talks and then answer the question. What I was thinking of, especially during your talk, Andreas, was isn't the consequence of viewing each experience and perception as psychedelic that only those people need psychedelic substances that are in some way blocked or impoverished in their direct access to perception? So, following the question, maybe we're all shamans, except when we're not, and when we're not, we need to become them.
Yes.
Yeah, I'd like to add a little bit. So thank you for that little feedback. I mean, a shaman is somehow privileged in helping to access this dimension in a way. So he has been trained, and he stands in contact with, as you say, with the invisible forces, or with the, let's say, with the not materially present side of this reality. So with the soul side of this reality. So in a way, only if you practice to have this stable connection to the experience of this dimension, you can call yourself a shaman. And this is also why so many modern shamans are not really shamans, because they don't have this stable connection. And when I say stable connection, then it is obvious that although we are in full psychedelics all time with every breath, we do not realize this automatically. And this is a really important question. So we could say, actually, why do we not see this? Which then is, at least if you follow the, let's say, the Paris school approach, which I showed a little bit here, which obviously is happening. Why are we somehow excluded from understanding what reality is truly about in most moments? And why do we need so much practice to go there? And it's actually an open question for myself. What is actually, why is this happening? Is this necessary to stabilize the subjective experience, which then is necessary to allow these subjects, which we are, these individuals, to survive? Is this necessary? Is this the price somehow for individuality? Or is it not? Could it be different? And I'm trying also to experiment with this, to go deeper into this non-self experience. But it is clear that we cannot do this automatically in a stabilized way, I'd say, at least not in our culture. And it's important to see this.
I try to direct the question to David Yaden. I hope he hears us. So two sentences before that. So in 1996, I attended my first psychedelic science conference. It was organized by my later doctoral supervisor, Rolf Veres, who is sitting here. And obviously, it inspired a lifelong interest in psychedelics and psychedelic research and the puzzling topics around it. But at the same time, it also inspired some kind of confusion and anger. Like a lot of people were presenting their stuff in a very uncritical way, like presenting them in a like priesthood-like way. They themselves creating the idea that they are shamans, that are somehow superior to others in the field. So, if David hears what I'm saying, so
yes, I'm here.
Yes. So, are you familiar with what I sensed like more than 20 years ago? And from your point of view, how should we as professionals deal with these tendencies in the field to construct ourselves as priests or shamans? Or
Yes, I think Sandeep's point about the definition matters quite a bit here. If we're talking, if we're using the term shaman as a sort of religious professional of a certain sort of small-scale society, then it's sort of easy to say why we as scientists and clinicians aren't shamans. There's a extremely general sense of the term having to do with anyone who works with altered states of consciousness in any lasting and meaningful way. And so I suppose people probably use this term in different ways, but I appreciate, Henrik, the example that you gave of the tendency in psychedelic research conference spaces for some people to adopt a kind of preacherly or shamanistic kind of mode as if they have direct access that is revealed to them that others don't have access to. You know, I'm just coming from Oxford, where I gave a talk on psychedelic exceptionalism, and I want to make sure I'm not falling into it here. I mean, of course, every field has its charismatics and its people who will adopt this kind of aloofness and arrogance and charisma, that only they know the truth. But I also think we have to admit that psychedelics appear to draw it more than some other fields. Nick Langlitz, who's an anthropologist at the New School, is working on charisma as it pertains to psychedelic spaces. And I think that he's probably right in that psychedelics draw it more than others. There's simply a lot of unknowns and a lot of uncertainty that we simply don't know about. And there's a lot of fascination inherent to psychedelic experiences. So it's fertile ground for people who are prone to trade on charisma to set up shop in this sort of field. And so while I don't think it's unique to psychedelic contexts, I think we as a field need to be on extra, we need to take extra care about this dynamic, in my view.
If I could add, there are many aspects of psychedelics that are not unique to psychedelics. And in the vein of individuals setting themselves up as priests, spiritual leaders, charismatic figures, you also see this, for example, with the introduction in the 60s to the United States of Hinduism and Buddhism by a variety of charismatic figures who introduced not only a very interesting new cultural framework, spiritual practices, probably benefited a lot of people, but also sometimes a cult-like environment that led to antinomian tendencies, that led to all sorts of abuses, including sexual abuses and financial, etc. And so you are going to see that anytime you have a spiritual practice that goes by different rules, it's relatively unbounded by ethical norms. It then kind of depends on, well, what framework are we talking about? I think with medical or scientific practices, the ethics are very clear. We should not be doing this. But this isn't a field, it's a topic, right? There is no field of psychedelics. And so I suppose we need to pin down what exactly we're talking about, but.
Yeah, thank you.
Can I add? Yeah. So in my experience and personal experience, the center of this, let's say, mystical path, which is also opened by psychedelics, is egolessness. And it's egolessness in the experience that life is given in this incredibly, unbelievably sparkling way. So egolessness is the center of it all. So it's what it is about. But on the other hand, what we can see in spiritual traditions, and then also in how you framed your question, because obviously that is a problem, that there were these priest-like figures in early psychedelics, that as soon as there are special experiences, I feel myself entitled to somehow call myself, see myself somehow as somebody special who has the power to go there. And on every traditional, profound spiritual path, this is why there is a teacher to tell you that this is nothing worth at all. So this is why you need a teacher who tells you, be modest and lose your ego. And so it's the same thing. It happens and it's wrong. And it's the clear sign that you should not follow somebody who has this posture, because he will not be able to bring you there where you truly will enter into this compassionate giving from a source which is without ego.
Thank you, Andreas. So strange things happen when you talk about psychedelics and spiritualities. For example, you'll lose your moderator now, who is handing over the microphone to my colleague, Marvin. So in the architecture of what we do, we have 10 minutes. Maybe you also want to integrate one or other question from the audience, and then we'll follow with a more down-to-earth, patient, quote-oriented question. How do spiritualities, perceived spiritualities, appear in psychedelic therapies? So I say goodbye.
It's somehow leaving your own party, right?
Oh. No, I'm not.
Leaving the guests with a fridge full of champagne.
Okay. I think you can hear me, yeah? Are we good? This works, okay. Hey, good morning, everybody. I just came down from the philosophy track. Now, speaking of the potential pitfalls of following a guru and a leader in spiritual practices, especially with the involvement of psychedelic substances, did I get it right? You suggested that following a charismatic leader can only go so far in a healthy way, up to the point where the person says, I have nothing to teach you, it's about your own experience, that you need to develop your framework around, or that you come to wisdom?
No, I said that a true teacher must have overcome his ego. If there is ego left, he cannot teach you. It's impossible. He will just somehow bring you into a relationship of dependency. Maybe he or she can teach you only that far. This is why it is so difficult to find a good teacher, a true teacher. And it's crucial. It's absolutely crucial. And this is why actually it is good to go into what we call nature, because nature is egoless. This is why people go to nature and find the teaching about egolessness and about giving life in nature, because it's egoless. And so it's wonderful. But in order to accompany you on this path, it's also good to have a human. But if he or she needs to have left his ego, and it becomes more and more difficult, I think, in our times. If you look around to all these gurus, they're big egos. Don't go there. It doesn't help. I didn't get the question. No, it's a very short question. You ask if is the guru complex related to masculinity? Yeah, well, most are men actually, but I would say it's human, and it's our contemporary narcissism. So it might be kind of more prevalent in masculinity, but it's not entirely gender-based, I'd say.
I'm thinking about something. In my view, we've been circling around in various ways in the past few minutes, and even in the two talks we heard, and that is the role of death. Because I was wondering what makes psychedelic experience different across various cultures. And when you were talking about egolessness, and when David, when you were talking about bracketing out something, I was thinking that maybe in that kind of immersion we talk about, when we talk about psychedelic experience, aren't we bracketing out the fear of individual death? Because we can talk about nature and giving life by breathing out, but especially in Western culture, we are concerned with individual death, maybe in a more severe or anxiety-driven way compared to other cultures. So I wanted to ask the audience and the fellow speakers what you think about the role of fear of death, or the fact that individual life ends for psychedelic experience and immersion.
I think it arises frequently in psychedelic therapy. Frequently meaning not all the time, but a fair amount, where people have experiences of dying or fearing that they will die. And the navigation of that ends up being quite important, and often relies on certain kinds of emotional skills that are generalizable. Even if that was not at any point a specific focus of preparation or what have you. So I think it arises frequently.
Can I also say something?
Please go ahead, yeah.
So to me, the experience of egolessness, the true experience, is a death experience. It is a death experience. And it is a death experience in terms of understanding that death is different than we fear it from the perspective of Western culture, like switching off the light. It is not like this. And it's basically the experience of existing in this continuity without personal ego, but still with a perspective on what is going on, which is profoundly meaningful, which is a death experience. And so I'd rather say that going there, which is difficult and which might be frightening, but going there is able to change our society's neurotic fear of death as the end of a sort of cherished object, which is very important. It's very important for an ecological consciousness, for change, to understand that life is somehow cannot end in a way, but your ego ends and must end.
If I could respond to that. I mean, that's quite a strong claim. And just sort of adopting a pragmatic, empirical attitude towards this, many people who take psychedelics, for example, high-dose psychedelics, may have an experience of ego loss where they feel that they have died. They may also have an experience where they don't feel that they have died, or that their beliefs towards death have changed or have not changed. So while this may happen frequently, it's certainly not universal, and it's certainly not necessarily true, I think.
I think it's, this microphone is now. I think it's also, yeah, 1 second, just a comment. I think it's also worth debating the boundaries between these ascribed concepts of ego dissolution, oceanic boundlessness, ego death. I think it can also get quite blurry. But we have a question from Andrea.
I actually would like to not ask a question, but just comment on that. I've been an emergency doctor for several years, and I've signed around 200 death certificates, been around people dying quite a lot. And I can assure you the only death experience is death. Mm-hmm. So to me, what people experience in these spaces might go very far, but there is a functional difference between somebody actually dying and somebody coming to a state where he can be very close to the experience of ego death and so on. And what I can say is that I've seen it in others and myself, that having psychedelic experiences is very helpful if you are with people undergoing this death experience. Mm-hmm. Because you learn to hold space in a way that otherwise you might not be able to, and able to stick it out, even though it's very challenging.
Yeah, thank you. I could respond, but I don't want to sort of like pull this into a certain direction, because I'm very grateful for this. Thank you very much.
Yes, we have the time, please.
Yeah,
Go
can
ahead.
I? Okay, so it's really lovely. We got to this point. So you're absolutely right. I agree. I haven't been there, obviously, because I'm sitting here. But then it is also important to see, and now I come back to this biological observation, that our embodied existence is a continuous death process, because we are dissolving, we are being eaten, and it is not it is not this sort of death, which is the end of individual movement, and you're dead, and you go into a coffin, and people mourn, but it is still a death. And to me, it is very important to see that that transformations and threshold crossings are a functional condition for life to continue. So we are familiar with death processes, and we are familiar with taking a perspective which is not the perspective of our ego. So our body takes a perspective in many respects which is not the perspective of our ego. And I think it is very important to infuse this back into our idea of what does it actually mean to be alive. And of course, this is not death in terms of certificate, but it is also death. And it gives us knowledge about this. And then if you look at reports from people with these profound mystical experiences, they tell you that they were somewhere where they didn't know if they were dead or alive. Even my teacher, even Varela, and you can even find it on Vimeo. Some accounts would actually closely before he died of liver cancer, like weeks before he died of liver cancer. He talked about his experiences with his teacher when he said, I was there completely without ego. And when I had this liver transplant some years later, I was there again. And somehow it was actually, I was indifferent if I would live or would die on some level. So he kind of ventured there, and he took this experience with him. And what he always held was this level of something extremely blissful and soft, which was related to this. And he said it feels like home. And I mean, he was a cognitive scientist. And so I think we should really see that there are doors into this experience which help us to understand so much more about this and about the other side of this door, which is our continuous being born in every moment. And we should explore them.
I think we're bracketing out David. He unmuted himself.
Yeah, thank you. Yeah, interesting discussion. I want to bring this back into the empirical domain to some extent, and to pick up on Marvin's comment about what do we mean by egolessness exactly in terms of what people say and how we can measure it. There does seem to be a common acute subjective effect of egolessness that's clear that people can vary over the course of a day, and of course in extreme experiences on this dimension of what we might call egolessness. But I think it's important to situate it in this measurement paradigm so that we don't overstate it. There are a number of acute subjective effects associated with psychedelics that contribute seemingly to the therapeutic benefits. And egolessness is not necessarily the dominant one, or even the top several of those candidates. For example, feelings of connectedness and egolessness are often taken to be two sides of the same coin, and they are indeed highly correlated, but they are differentiable. And any time that I've seen in the data, when you differentiate egolessness and connectedness, connectedness is doing much more of the work in terms of therapeutic benefit and effects on well-being. And so in some ways, the emphasis on egolessness, while interesting and while relevant and important, I don't think is necessarily decisive or even maybe the most important of the acute subjective effects that lead to lasting beneficial impacts. So I just want to bring these other concepts into the conversation and lend a kind of empirical perspective.
Right, yeah, thank you for that, David. Also talking about spiritual practices, shamanic practices, of course, these are also deeply connected, mostly culturally embedded in large cosmologies, right? So this is not necessarily only about, so you took it back also to therapeutic change, and I would like to bring it in the domain of meaningfulness, existential questions. I think this is also partly where you were going, and a depth of connectedness in life because you feel like you've seen the other side. How do you think should this be integrated in practices, medically or not medically?
Sorry, should what be integrated into?
So how deeply relevant do you think, beyond looking at therapeutic changes, would be such near-death experiences or transcendental death experiences in psychedelic practices outside of the medical context for meaningful lives? That's still unclear.
Or maybe it's difficult because I think some topic of our panel is how can we have psychedelic experience like in any perception or any conversation with others or any process we enter. And that's what I find interesting because I think a lot of people from non-Western cultures would have trouble answering the question, how do we integrate psychedelic experience in everyday life? Because it is in everyday life, like Andreas mentioned in his talk. So if I understood your question correctly, it is what can we learn from psychedelic experience, or how should psychedelic experience be part of anyone's life? And I think Andreas's talk gave kind of an answer to that, because, well, looking at a butterfly can be a psychedelic experience in terms of learning something emotionally about yourself, about others, or about life. So I think it's more of changing your mindset to everyday experience than using these extreme experiences we've been talking about in the past few minutes. I think we don't need near-death experience to lie in a meadow and have a good life.
Mm-hmm. Yes, I can support that. We have a few more minutes. Yes, there's a question here.
Yes, hello. I have a question about the role of, let's say, wisdom, experience, knowledge, which is not evidence-based. So as professionals, we cannot be missionaries, but should we be obliged to offer our patients contact to wise elders, whoever they are, in terms of integration, if there is the need?
I can speak in the capacity as a clinician. So these things come up frequently, right? People have spiritual experiences. They may have experiences that alter their metaphysical beliefs, even transiently. They have questions, right? They have many, many questions. And if you occupy a clinical frame, I think the ethical framework is very clear. You should not impose your own belief system, but you also should not necessarily impose other belief systems that you think might, I don't know, complete the person's quest or what have you. Just with a non-psychedelic clinical encounter, people may also have these types of questions. You may help them explore them in a relatively, non-directive way, but the hope is that you're not infantilizing them by giving them the answers for things that are ultimately very, very personal questions. So I don't think that we need to reach for a separate frame of practices, a separate frame of ethics. Just approach it again. And once you step out of the clinical frame, things become very murky. So I'm going to choose to bury my head in the sand and not comment on those.
Yeah, I saw you first, and then you next to him. You next to him.
Thank you. How would you, sorry, were you first? Was that for you?
You'll have your turn. It's okay.
All right. No worries. It was in line, so you couldn't. All right. Thank you very much. I would like, probably especially David, if you could comment on psychedelic therapy for the terminal ill. So people who are facing death, end-of-life anxiety, for people who know they will actually die. How does the role of their spiritual beliefs or religious beliefs change in importance closer to death in combination with the psychedelic therapy?
Yeah, the end-of-life context is particularly interesting, and it seems somehow resonant with aspects of the psychedelic experience. Actually, that was the direction that a lot of the researchers were planning to take, is this end-of-life context, and we're guided to approach larger diagnoses because of the potential impact, positive impact that could be had on them. This is a domain where there are not a lot of great psychotherapeutic or psychopharmacological tools available that provide what we might hope. If you think about how you would ideally like to die, it's maybe not the most pleasant thought on a Saturday morning. But if you take that thought experiment seriously, what would a good death look like to you? that vision, there's been studies on this, tends to not align very well with the actual lived reality, so to speak, of how people actually die in our contemporary society. For example, people generally want to be able to review their life and the meaningful moments, to have some degree of lucidity, to have a connection with friends and loved ones. However, the physical and mental pain experienced during this time often prevents those things, those valued experiences from occurring. So there's a great deal of suffering here, and it's worth considering how we can improve it. And psychedelics, for some, may be one of those tools. I think that there's actually potential there. And when I do this thought experiment myself, I am very open to the possibility that if it were possible, a psychedelic, could open me in a time when it's very easy to close down. But there are also great risks. There are always risks with psychedelics, as I've tried to reiterate, and those have to do with risks to well-being, but also epistemic risks. As Chris Letheby has talked about, we can sometimes, we see people adopt beliefs that they otherwise wouldn't. And in my mind, the stakes are raised in this end-of-life context because there's perhaps less time to integrate those beliefs. So we don't want to consider someone being brought into a state of deep confusion that would increase their suffering even more. And of course, during the end-of-life process, metaphysical beliefs and views on existence come to the fore, so people will be actively processing. So all of that's to say, I don't know the answer. I do think, though, it should be studied so that we can quantify this risk-benefit ratio and eventually transparently and clearly communicate the risk-benefit ratio to individuals who are deciding whether or not to engage in this sort of treatment. I think there are real risks and I think there are real benefits, and I do think it's a context that is worth studying much more deeply.
Thank you for this very to the point position. Do we have a direct comment in the group, or shall we move to the next question? Yeah, next question, please.
Okay, so I'm not sure if you're familiar with the concept of spiritual bypassing. Nodding, thank you. So I was wondering, because psychedelic experiences seem to be a fast track for some people to spiritual awakening, and it seems to have good effects for well-being of some people if you have a connection to faith, your own belief system, whatever that is. But then for some people, there's the danger that it will serve as just another form of avoidance, of engagement, connection, and so on. So I wanted to ask you if you can comment on this very complex problem that psychedelic experiences seem to also evoke that kind of phenomena.
You said you were addressing David or the group?
Whoever, no, whoever feels like this is their forte.
I could say something. Maybe David wants to say something as well.
Oh, go ahead and I'll speak after you. Thank you.
So yes, that's a real danger, and it's sort of a little bit. It's the same category of finding the wrong teacher in a way. It's a real danger, but well, let's say the danger is to try to avoid the necessary painful work which comes up when you make these experiences. I'm not familiar enough with psychedelics to be able to tell you from the inside, but I know from, let's say, from a spiritual path that inevitably, if you go there, there will some profound pain come up. And this needs to be somehow worked through or suffered through. And spiritual bypassing means that you only take the nice bits and you try to ignore this. And if it doesn't work anymore, you go somewhere else and you try to consume the bliss and not to go to the truth where it somehow points you. And I know that psychedelics bring out also the deep work. So it's sort of like your decision to take it or not to take it. And then again, a good guide helps. A good shaman, a good teacher helps. And it's an offer to you. It's an invitation to go there. And it takes courage. But every true spiritual path takes incredible courage to really lose this which holds you back, I'd say.
This might sound silly, and I'm not a fan of the person, but it just came to my mind. Terence McKenna said, take it, but take it easy. David, please.
Yes. So with this question and with some of the belief-based issues that we were discussing earlier, I think what comes to mind for me is the importance of not only in informed consent, but in the preparation process to very directly address these issues so that participants or patients or just people engaging in these experiences are not surprised if these dynamics come up, if they find themselves quickly changing their beliefs, or if they find themselves all of a sudden entirely devoted to a spiritual path that they were previously uninterested in. I think if these possibilities have been discussed ahead of time, it increases the likelihood that they will be more wisely integrated afterwards. If in the therapeutic context, for example, or really any context, a guide can raise with the individual, look, remember we talked about this. Remember we talked about how this is possible. Might we consider the possibility that your current preoccupations are related to your experience? And I think if these conversations are ongoing, if they're happening at the consent process and the preparation process, then they can be maybe ameliorated much more effectively in the integration process if these are ongoing, and that no one is surprised by this possibility. I think this again fits into this idea of how can we most transparently and simply and clearly explain the risks and benefits. And I think what you're raising is a real risk that's worth considering and communicating about.
If I could add a little bit, just speaking purely anecdotally as a clinician working with people in these types of trials, one thing that doesn't get discussed all that much is that in the days or even a couple of weeks right after the session, you sometimes see somebody who they are almost trying on new types of beliefs or new ways of thinking, some of which get discarded. And I would say this is not necessarily the norm, but in these cases, I've sometimes had the troubling sense that if I just tap, just give a little push, I could actually goad this person to settle into maybe a kind of way of thinking that they otherwise would not have. And I also think that kind of in naturalistic use, you'll see that people will sort of engage with new social circles. And that will kind of be a way where that can be for good or for ill. But I think ultimately, people should be helped to make intentional decisions, not necessarily rapid or rash ones, and trust that with respecting people's autonomy and giving appropriate support, they can make good decisions. But we should certainly not be making those for them, I think.
Great. Unfortunately, we have to move on in the program. We have another leg of the symposium ahead of us. Well, I would like to say a couple of words more organizational. I'd also like to give you a chance if any of you has a final remark, including David. I'd like to pass it back to you in a moment, but of course it's not obligatory. Good. So this has been the first half of our Spirituality Symposium. I would like to bring to your attention this wonderfully designed questions box that you're all most welcome to enter your naive or not so naive questions that we'll address today in the afternoon at, I think, 4 p.m. or 3:30 here in the auditorium in an audience interaction. We'll post this, place this next to the door, and please know this exists, and we'd like to have your questions for this afternoon. Now, before moving on, does any of the speakers and participants want to say something? No? No? Good. David.
Sure. I would just invite all of us to take seriously the, I think, ethical obligation to speak from the evidence base whenever possible as it pertains to psychedelics. This is a topic that attracts extreme statements routinely, both extreme positive and extreme negative, but in both cases, really beyond the evidence base entirely. And when you add well-being and spirituality into the mix, it's like pouring gasoline on the fire. And so what I would advocate for is a great deal of care and for popping hype bubbles and misinformation, challenging misinformation whenever it crops up in the wild. And so that would be my invitation and my plea. But thank you for having me.
Thank you. Very important word of caution. A round of applause.